Hello, everyone, and welcome to CyberTalk's panel discussion on IoT-based attacks in healthcare industry. Do you know how to respond? And our panelists for the day, Scott Augenbaum, Danielson, and our moderator, Amol Kodag. I'm Khaled, and I will be your host for the day. Some instructions for our attendees. The session will be in listen-only mode and will last for about an hour and 15 minutes, out of which the last 10 minutes will be dedicated for Q&A. If you have any questions or need any technical assistance during the webinar, please do write to us in the Q&A window. For the certificate of attendance of this session, we have two criteria. Do note, participants need to attend the complete webinar to qualify for the certification of attendance. Participants should also fill out the survey form in the attendee thank you mail, which will be sent to you a day after the session, and answer all the 3 MCQ questions based on the webinar. Let me introduce our panelists to you guys. So Scott Augenbaum. Scott has a very successful career with FBI for the past 3 decades. He has responded to over 1,000 cybercrime incidents whose victims lost their life savings and many lost their reputations. He has helped companies reduce their chance of becoming the next cybercrime victim by 90% without spending a dime on any product or services based on a simple step method. He is also a go-to expert for all the primetime network channels to share his cyber expertise. Rico Danielson. Rico Daniels has an extensive experience in handling cyber incidents response, cybersecurity, information security, privacy, and compliance. Rico has helped many retailers, financial and healthcare organizations to mitigate threats and risk from an information security and privacy and compliance standpoint. Further, Rico has handled cyber incidents for major world-renowned healthcare, financial, and retail firms. He is also a digital forensics expert from criminal and civil court cases. He is also a graduate from Thomas Jefferson School of Law, UCLA, and the University of Arizona. He is also an U.S. Army combat veteran who is actively involved in entrepreneurship. Our moderator for the day, Amol Kodag, is a senior engineering and technology leader with record of leading global R&D teams, developing innovative products and technology platforms, especially in the space of industrial IoT, vehicle and aerospace. He has a critical leadership experience in building and heading various product and technology verticals, Center of Excellence in Connected Solutions, specifically software, IoT, cloud, and cybersecurity. Amol currently works as an engineering director R&D, heading the cardiovascular profile at Medtronic's Engineering and Innovation Center, and is focused on building patient-centric connected care solutions. Without any further delay, I hand over the session to you, Amol.
All right. Thank you, Khaled. Good morning, good afternoon, good evening to all our wonderful audience from around the globe. I'm Amol Kodag, and as a panelist, I will be moderating this session today on this very interesting and critical topic of IoT-based attacks in healthcare industry. Looking forward for an engaging discussion with my fellow panelists, Scott and Rico, and an interactive Q&A session with all towards the end. Now, in Internet of Things, devices gather and share information directly with each other and the cloud, making it possible to collect, record, analyze new data streams faster and more accurately. Now, we have seen IoT revolutionizing the consumer and industrial world. We have seen smart TVs, we have seen smart lighting solutions, and as simple as now, even the doorbells are becoming IoT enabled, right? So then we have the smart factory, and then we have intelligent cars. Now, these cars are sensing wear and tear and self-scheduled maintenance. Now we are talking about also the buses and trains that dynamically calculate and report projected arrival times to waiting passengers. A lot of things are happening in the world of IoT. And likewise, IoT offers a great promise in the field of healthcare. Now, IoT principles are already being applied by the leading organizations to improve access to care, increase the quality of care, and most importantly, reduce the cost of care, right? It's about the economic value. Now, we are able to see more and more exciting IoT-driven healthcare applications and systems emerge now, but this race to manufacture IoT devices for the healthcare sector has also caught the attention of our cyber criminals. You know, When attacks take out business systems, organizations suffer from direct and indirect financial losses. But when it comes to healthcare systems, it may become a matter of life and death. So that is the focus of today's conversation, right? All right. So next slide, please. Okay. So let's start by focusing on the big why. You know? So hey, Scott, now you got an interesting background in FBI working on cybercrime, 30 years, man. Wow. So for our audience, can you cite an interesting example of major security breaches in healthcare? Some of the high profile data breaches that you might have responded to. Over to you, Scott.
Well, great. Good. First of all, good morning, good afternoon for everyone all around the world. It's so great to be here on this panel. I'm Scott Augenbaum. I am a retired FBI special agent, and I got sucked into working cybercrime back in 1998 when the FBI became the lead law enforcement agency to handle cybercrime matters. And it wasn't a cool, fun, sexy job to have, because here I was, a young FBI agent handling bank robberies and fugitive cases and drug cases. And all of a sudden, I believe it was a presidential directive 63, which was made by Bill Clinton all the way back in the day, that brought us into it. And since I was the only agent in the office with a home computer, and the only reason I had a home computer was I understood Windows 95, and I was an early adapter to America Online, I got sucked into the world of cyber. So I just want to give you a little bit of background before we get to this healthcare stuff. In 1998, 1999, my role with the FBI was to go out and inform the private sector, critical infrastructure within the United States, that the private sector needs to be working with the government on keeping critical infrastructure safe. And I'm going to be honest with you, I don't really think it's happened, because I've been dealing with this for such a long time. And then in 2002, we start seeing major phishing attacks. The FBI forms a cyber division at FBI headquarters, where we work on a national cyber strategy, which is to interact with the public. We have 56 field offices throughout the United States. I get to Nashville, Tennessee. And Nashville, Tennessee is very unique because we are the Silicon Valley in the United States of healthcare organizations. And we have about 500 or so made healthcare companies. And during my career, I had the opportunity, and this is what we're going to talk about, to interact with these companies, look behind the hood, and see the incidents that have been going on. And I'm going to be honest with you, I've been seeing attacks at healthcare since 2008. And I've seen foreign threat actors go into major healthcare organizations to compromise their infrastructure, to use that as attack points for clear defense contractors in the United States. One of the big topics we're going to be talking about today is ransomware. I've dealt with dozens of incidents with ransomware. And everyone's like, wow, how did this happen? Well, in 2016, I was providing guidance to healthcare companies on ransomware prevention. And you know what? Nobody wanted to talk to me. Everybody said, hey, this isn't going to happen to me. So there's so many gamuts here, and what you hear about in the paper is really not what goes on behind the scenes. Because I have been the one, and we're going to dive into this. I've been the one to bring the bad news to major companies and say that you have a problem. So when we get into this, and we're going to be talking about IoT devices, I'm going to tell you, I'm scared, because a lot of the healthcare organizations cannot keep their basic networks secure from ransomware, data breach, the business email compromise. And when you're telling me now that we're going to be putting devices, they could be medical devices, they could be air conditioning systems, I'm a little scared about that. So let's just kind of set the stage. And I've been talking about this, that healthcare needs to develop an effective strategy, because you want to know what happens if you don't have a strategy? Rico, who's probably one of the best in the United States on intrusion response, after the FBI tells you that you have a problem, you're going to have to bring a guy like Rico in to clean your messes up. So I'm really excited here. I hope that kind of sets the stage where we're going to be going today.
Yeah, no, thanks. Thanks, Scott. Rico, you want to add anything from your side?
Man, that's a hard follow-up with Scott, I'm telling you. I'm just a simple Southern boy right now. But nonetheless, if we take a look at a little bit of a deep dive, he brought up a very big case, a big use case. If we take the use case of Banner Health, in fact, that actually was a compromise specifically around an IoT device, and more specifically around a purchasing device, where the attacker was able to pivot and actually gain network access to specific hospitals and then traverse there. For a long, long time, they actually set up a footprint within the hospital and was able to exfil data. That, you know, what Scott just talked about was the exact example of what hospitals do not do. What they don't do is they don't really take their security hygiene into real high critical perspective, and they don't put the compensating controls in there, and they don't really do the follow-up. So unfortunately, you know, hospitals are going to be more and more susceptible to it. And that's just one use case I was actually a part of. The other ones I've been a part of were anywhere from medical devices coming online. I worked a wrongful death case where a medical device was actually breached and compromised, and the manufacturer say, we gave it to the person. It's not our fault that it was not secure. So that what that leads me to believe is that we actually have to be our own first responder. We actually have to be our own person or our own advocate for our own security, and to make sure that that device that is transmitting our communications of packets to our cell phones, to our network or whatnot, it has a minimum security standard at a bare minimum. And right now, the Internet of Things, the IoT medical devices really don't have any standard. So it's up to us to step forward.
Yeah, thanks, Vikram. Thanks for that answer. And by the way, again, this is more of a communication to audience. All the views that we are expressing are more of our individual views and does not represent the organizations we belong. But yeah, thanks, Rico, and thanks, Scott. So these major attacks like WannaCry, for example, has stalled operations in many hospitals and clinics, preventing medical personnel from accessing infected devices. Right? So the threat is real, threat is happening. And these attacks have again and again highlighted the need for continuous improvement of security practices in the healthcare world. Let's go to the next slide. Now, we talked about the why, big why portion. So let's understand the threat landscape for IoT in healthcare. Now, original goal of ransomware, for example, what Scott talked about was to demand ransom from the target in return for restoring the access to this data. But over time, this goal has evolved into stealing sensitive data, threatening data breaches if the target does not pay the ransom. So maybe Rico, this one is for you. I would like you to share with our audience, what does the current threat landscape for IoT in healthcare looks like? If you want to share your thoughts there.
So the threat landscape for IoT devices, and specifically around the healthcare medical devices and supporting the medical healthcare arena and industry, is vast and wide. And it's very, very of a high altitude and also a very wide area in which threat actors can jump in. Manufacturers of devices, let's take kidney pumps, diabetic pumps, cardiovascular pumps as well. They're just putting devices out there to do the job, right? These smart, dumb devices are only going to do what it's told to do and what it's programmed to do. So I, as a threat actor, would possibly look at the capability of these devices and say, what can it do? What is the capability of it? What's the max threshold it can do? And then on top of that, what I'll try to do is actually exploit that. And then from there, to see if I can overwrite the system, see if I can overburden the system and make it fail. If we get to that point right there of the medical device failing, what good is it going to do for us? And if we provide those use cases in which some people have, and the manufacturer doesn't remediate it, that's going to be a very tough thing to do. And also a tough thing to digest, especially whenever there's a wrongful death or there's somebody's critical data is gone. I personally have had my own information compromised from the OPM breach, and I could only imagine if I get a medical device and somebody has my information as well, and they marry that up, how much more, one is a privacy violation, right? And then number two, Now can somebody consume my identity because they also have my medical information as well? So some of those, the threat landscape is going to be very, very large, and I think it's going to be self-induced, not only from a manufacturer perspective, but also from a consumer perspective.
Enrico, I just want to chime in on one thing that you said. I mean, we're not saying that IoT devices are bad. I mean, if I'm coming into a situation, I need one. I don't want you to think that anyone wants to stymie innovation. However, we have to balance one important term: usability and security. So when we deal with large organizations and they're putting these devices out to market, and they're not thinking about the threat actors, I'm going to say it's kind of careless here. You cannot go back and build security on top of an existing product. It needs to be baked in, and so often we're dealing with this, and this isn't just the medical industry. This is our IoT, which is in our air conditioning, which is in our cameras. You know, what are we dealing with today? We're dealing with what we believe are razor-thin margins, and people don't want to pay the extra money for security. And we're not even going to go into supply chain threats here. Where are we getting these components that are coming in? Are they coming from what we would consider threat countries?
True, very, very true. Those are definitely things you have to take in consideration as well. You said something very, very key point, Scott, and we talked about this. How can we do security without spending a lot of money, or if any money, right? And one of the things you're advocate on, I think we talked about this one, is shifting your mindset, right?
Yeah, no, absolutely. And you know, and I don't want to oversimplify the problem, but if we're sitting around, and I mean, just think about what we're building today and how inexpensive it is. You know, everyone talks about all these different threats at IoT devices, and I'm like, I just see people are compromising passwords.
Yeah.
And you know, nobody's getting into, I mean, it's really hard to hack an air conditioning system at a major manufacturing plant. However, it's really easy to steal the username and password and shut it off.
Yeah, no, absolutely, absolutely. And again, thanks, Scott, and thanks, Rico, for sharing those insights. The threat landscape is quite challenging, especially in healthcare, and with the cyber physical systems and the IT infrastructure and the implantables that go inside the body, right? The IoT devices marrying together, and you know that is it's complex problem to solve. The threat landscape is complex. So on that note, I would like to ask Scott, and maybe we can move to the next slide. And this one is interesting. Now we have these various threat actors, right? Like we have seen organized cybercrime, we have seen inside agent, that is also a problem, right? And the bad actors, and even the state-sponsored threat agents in the healthcare world. So Scott, I mean, obviously you have investigated some of these crimes and all. And you have looked into this. Who do you think are the primary threat actors in the healthcare sector, and why are they specifically interested in this sector? Any thoughts?
Well, you know, when we look at it and we look at the threat actors, you know, they used to be targets of opportunity, where in the old days we would see very, very complex attacks. No, not complex, more like shotgun attacks, where the bad guys would go out and reach out. But now we're starting to see more of a targeted attack on healthcare. We're seeing nation states are getting into healthcare to try to get intellectual property, to try to figure out how we're doing things, especially in the world of research and development. That's why here, you know, when I was with the FBI, we were really doing a lot of threat briefings to major research and development facilities, because in the United States, we're spending billions and billions of dollars on the production of intellectual property, where we're seeing the theft of it and it being replicated all over the world. So we have, you know, the theft of intellectual property, we have the threat of very, very sensitive research. Now we're dealing also with what I've been seeing a lot of, which is the business email compromise. And this is targeting the financial aspects of healthcare, where their bad guys are getting into the email systems at major healthcare companies, because a majority of them, in my experience, were not using two-factor authentication on their email. Bad guy would get into the email of the healthcare company, read all the emails, see how they did business, and spoof an email from the CEO to the controller. Now, remember, a lot of companies say, hey, we got a great email solution, but now they're inside your network. And that's the big thing that Rico and I were talking about. Once they're inside your network, and now, and I specifically, your email, they're able to send that. And I saw the bad guys get in and suck out $5.8 million out of one major healthcare company. And they called me into this, and I was like, guys, this is not an IT problem. This is a business process problem. Now, when we start thinking about that, that's just the financial side because of the healthcare systems, and a lot of corporations aren't using two-factor authentication on their remote access. So the bad guys are getting into the payroll systems, they're getting into the HR platforms of healthcare companies. And remember, we're not talking enterprise too, we're talking small and mid-sized healthcare organizations. And then we are also seeing the theft of sensitive medical information. And a lot of times they go, and I walked into situations where they go, oh my goodness, I can't believe this was a very, very sophisticated data breach. We were HIPAA compliant, we were high trust compliant, we had a great firewall, we had antivirus. They didn't have two-factor authentication. Bad guy gets into the Microsoft account, logs in remotely, gets into the shared drive, and exfiltrates all the patient information. And then all of a sudden they go over and they go, it was a very, very sophisticated breach. Right, Rico? How many, am I speaking out of context? How many data in healthcare fall into that category?
A lot of data breaches fall within poor security hygiene, unfortunately. Some of them, the threat actors already know that everyone's looking for the very sophisticated attack, the one who's going to leave the big footprint, that calling card in the background, but nobody's paying attention to the subtleties, right? Nobody's paying attention to the underlying things of critical common hygiene. And the more and more people get away from that, the more and more hospitals get away from that, the more susceptible they're going to be.
And one thing I want to kind of follow up on that, I'm not saying that we don't spend money. We need firewalls. We need intrusion detection systems. We need this. But when a majority of the incidents that I responded to in my career easily could have been prevented, why don't we just do that first? That to me is what kind of drives me to do what I do.
Yeah. No, yeah, I think, well said there. So there are certain simpler actions which can help us to prevent some of the major breaches. And then and at the same time, some organizations are mature now and they are looking into all these things. But at the same time, now we are talking about advanced persistent threats, or APT is what we call, right? And for audience, basically APT is a stealthy threat actor, typically a nation state or state-sponsored group, right, which gains unauthorized access to computer network, and it remains undetected for an extended period of time. So in this case, yeah, yes, Scott, go ahead.
Advanced persistent threats, APT, we call it average phishing techniques in the FBI, because a lot of times what we're seeing is a young organized criminal threat actor out of West Africa who got all these stolen usernames and passwords off of the dark web and logs in remotely to one of the administrators here. So there are threat actors, and we got to take them seriously, but let's deal with the low-hanging fruit.
Yeah, sure. Yeah, I think true. And low-hanging fruits, and then there are traditional security measures may not work for this kind of APTs, and we have to look at the adaptive strategies there. So yeah, I mean, these threat actors are different, and there are different strategies that we have to focus on to make our system secure. So on that note, maybe I'll move to the next topic on the current state. Can we have the next slide, please? So again, here we're talking about what industry is doing about it. Right now, a lot of efforts have been put by industry, and maybe I would like to share my thought, but maybe I'll first ask Rico, why don't you share, what is healthcare industry doing about it? What regulations are being formulated or exist to take care of these challenges we talked about?
Absolutely, absolutely. So when it comes to medical IoT devices, a lot of the current healthcare administrations and also hospitals and whatnot, they're doing the best effort that they can of what they know, what they got, right? And the other aspect of it is they're referencing what might work in their infrastructure, such as, their firewall, their AWS environments, anything like that. However, they're not really taking a pivot point and saying, this is a good reference point, but we need to focus on what IoT devices is coming in, where is it laying at, how's it transmitting, what's the encryption level, and where's a handshake at. So at that point, if we could use a framework that we use, but if we pivot it and more specifically look at the IoT devices, would give us a great idea to have a standardization. Now, what regulators, they say they have the NIST 853, hey, do these things, but that's just a general blanket. What we actually need to do is take a deep dive into each device, and this is where the rub is going to kind of happen, right? There are so many medical devices. If you walk into an operating room, there's beyond medical devices. You have the monitoring machine, you have the electronic dashboard that you can type in your information. You have a pump, you probably have a surgical device as well that's communicating wirelessly. So that's 5 things already. We actually have to sit down and understand the capabilities, transmission, and overall the technical configurations. At that point, we will have a standardization of what works and what won't work. And what regulators don't understand is they're the old school, hey, I have the NIST 853, you have to do these things. Great, no problem. But that's for this, and that's not for IoT.
And Rico, let me just, on the technical side here, and this is way over my head, and this is why you're an expert at this, aren't there situations where we're seeing some of these medical devices are being left exposed, accessible to the internet? And also, remember, what causes a majority of ransomware? Unpatched systems. And a lot of these devices are legacy systems. So what are you telling clients, how difficult is it for you? Because I had a very difficult time getting these people to take the simple steps. But when we start dealing with looking for their networks and their devices, and I talked to a lot of the chief information security officers at these hospitals, and they're not really as involved with the operations network as they are with the IT. So how do you communicate that to people?
That's right. That's great. Great question. Great question. So a lot of IoT medical devices, they have to operate on a certain specific, and what I'm seeing is this specific version of an operating system, right? And it might be patched way outside of 2016, 2010. I've even seen some XP stuff, and they say it works. It works. We need to keep it working. Don't touch it. And I empathize with the network guru, and I empathize with the infrastructure person, because if it works, please don't mess with my stuff because it's going to break, right? However, whenever from a security perspective, it does injustice to the consumer, the patient, and also the business. So the best thing you can do is we ask the question why. As a hospital, say, hey, why is this at a patch cycle? Is it because of the functionality? Is it the feature? Tell us why that, and you build around that. You build a layered approach around the cybersecurity aspect.
And then if you don't, you're going to get hit with ransomware. And the question I get all the time is ransomware. Do you pay the ransom or you don't pay the ransom? And think about this. I mean, I always say that's the wrong question. We should be talking about prevention, because I would hate to be in that situation where I am a medical device maker. One of our devices gets impacted, and now you're forced to make that decision. Because let me just tell you, in 2 things in law enforcement career that I've dealt with dealing with over 1,000 incidents, law enforcement's not going to come with a magic wand and fix the situation. I mean, it's that simple. We're collecting intelligence. We're trying to get these bad guys prosecuted all over the world. But since, as we talked earlier, a majority of the threat actors are located outside of the United States, it becomes very, very challenging for law enforcement. That's why the burden has to come back on the private sector, on the innovators, to start thinking about these things before it becomes a little too late. Because if we're seeing major ransomware attacks at hospitals, I don't want to think about what happens 5 years down the road when we have all these devices and now we're seeing threat actors who got into the OPM database, which is all government officials, starting to be able to target people who have pacemakers and all these other devices. So that kind of keeps me up at night.
You know,
Yeah. Go ahead, Rico.
yeah, absolutely. You bring a very valid point, Scott. One of the things that I found myself in the last couple of years is actually helping people pay ransomware and talking to threat actors. And it's a very difficult decision because it has to do with a little bit of cyber and a big business decision. And what I'm starting to see in the medical area, in the medical space, is you better have that stuff geared up, because not if, but when a threat actor shows up, you're probably going to find yourself in a moment where you're going to have to pay a ransom. The question is, how are you going to do it, and how are you going to facilitate that? You have to be ready.
Yeah, and just one last thing, you know, and I get faced with that all the time. Do you pay? Do you not pay? Within law enforcement, we always said, don't pay the ransom. However, now the threat actors, if you get, and I want everyone to go, I want to go on the record on this. If the bad guys can get ransomware on your network, they had access and the ability to steal your stuff. And today, what we're seeing the threat actors are doing, when before you even know that you have ransomware on your network, they're in your system, they exfiltrated the information, they encrypted your backups, and now you know that you have ransomware. So now it becomes pay and pray. Because think about it, Amol, how long can an organization survive without access to their information?
Absolutely, absolutely. Scott, you know, that's a big challenge and a great question you pose. Now, my thoughts on this, right? Earlier, the regulators like FDA, for the medical devices or the IoT kind of devices, the focus has been primarily on the patient safety, right? And while patient safety is important, at the moment, many in the healthcare IT, right, with the IoT coming in picture, are concerned about securing healthcare organizations and protecting them from data breaches. Because now we are not just talking about the device and the patient, we are talking about the healthcare data and the data breaches, which point you rightly brought up, Scott. Now, just to answer the second piece on the regulations, right now, regulators like FDA have released the pre-market, and they have recently, for example, pre-market cybersecurity management guidance and the post-market management of cybersecurity for medical devices. Now, this guidance will help manufacturers to better update and patch their devices. But again, these are guidance. These are, you know, I think, like Rico said, you know, these are more of high-level thought processes which every organization have to personalize, customize, and implement in their day-to-day operations, into their day-to-day development. You know, now ISO 62304, right, for medical device software, it talks about security provisions, but are we ensuring, you know, it is implemented and due care is taken care of? The NIST cybersecurity framework, which Rico, you talked about, these are frameworks, but how much emphasis is given? So I think both of you pointed out very rightly, and I would put it in one line statement: is prevention is always better than cure, and that's where, you know, the focus should be for the organizations. So that's the current state, audience, of you know, how the industry is dealing with it. There are certain regulations from the regulators. Now, how do you ensure that those are implemented in terms of your day-to-day product development? That's critical. Now let's move to the next slide, and let's talk about the security response piece. So we talked about the current state on what the impacting, and we will talk about the response piece. So maybe Rico, why don't you take this up and try to answer this question?
Yeah, so when we look at it responding to a security incident, specifically around IoT, one of the bigger things we're going to have to take a look at is, what is your current incident response plan? What are you doing to respond to any of this? What are you going to do to respond? Who's your key players? Who's the key stakeholders? Who do you need to notify? Who's your technical expert? Who's your subject matter expert? These are the facts that you need to calmly and bring together. And then the second part would be to rehearse that. I know everyone's extremely busy, especially at the C level, all the way to administrative level. I totally get that. But if you just write up a 3-page document that says, this is my incident response plan, this is who I need to notify, and you let this sit there for a year, I guarantee you a lot of things have changed. And number two, you don't have that acumen and the testament to rehearse that. When I was in the Army, one of the things we always did is we always trained. We trained and we did hand-to-hand combatives, we did close quarter combatives, and that was every day. So when we went to combat, one of the things we always saw was we're actually, this is a habitual thing. We already know what's going on. So I implore our listeners, our viewers, hospitals, CEOs, is take this serious. You need to sit down and have an incident response plan, because you are going to be your own first responder when it starts. The FBI will show up, the Department of Homeland Security will show up, that's fine, no problem, but nobody's going to handle it but you. So you need to do the reasonable and also the right thing, right? You can't rely on your cyber insurance, because the cyber insurance wants to control the narrative and control what you do in the best interest of them. You are in the best interest of you, so you need to be your own first responder and develop your own response plan.
You know, Rico and I had a discussion the other night, and how long did we talk about this? Probably for a half an hour, and we had a couple of beers, so the conversation was very, very interesting. But you know, when we start dealing with intrusion response, it's so important. You got to practice. But what a lot of organizations don't take into account is, what do you do when law enforcement or the intelligence community comes to you and tells you you have a problem? So I have two situations here. All of a sudden, we're following a threat actor. We know who this threat actor is. It's a hostile nation state. And we come to you and we tell you that we know for a fact that they are in your network. What do you do? I mean, and that's the whole situation, you know, and that's why, you know, prevention is ideal, detection is a must. Are we segmenting these networks? Are we, because it is your worst day in the world. And I broke the bad news to a lot of organizations, because people always ask me, when do we bring law enforcement in? And I'm like, that's the wrong question. What happens when we show up at your organization and tell you you have a problem? And that's why you have to really start thinking about this. Are we segmenting our networks? You know, we have some very, very sophisticated pieces of medical equipment that saves lives. We can't, sometimes you can't patch it. That's the way life is. But that should not be talking, you know, should that medical device be beaconing out and talking to like a Tor network in Germany or something like that? These are the things that organizations have to look at and be able to bring professionals in. And I don't have the skill set to do that. I mean, but these are just some of the things that I've seen in my career, and I try to take that information and I try to say, look, put this in place. Let's do everything in our power to not be the next headlines in the New York Times.
Control your narrative. Yep.
Yep.
Yeah. No, absolutely. And I think Scott, you mentioned it right. You know, prevention is ideal, detection is must, right? On that note, maybe Rico, I mean, you know, we have a lot of security professionals joining us today on this webinar. If you have to put a high level of robust incident response plan, what would be those key items on that plan look like? Any thoughts there?
Yeah, so you want to start with the basic fundamentals, right? You want to start off with what you're looking at in regards to preparedness, right? What are you looking at in regards to what was your isolation mechanism? What is your remediation mechanism is going to look like? But if we take a step back, you know, step one, what do I do? Gather all the information, gather all the technical acumen, such as your network logs, your device logs, you know, kind of trying to understand your current threat actor, right? Number two, you need to sound the horn. You need to actually get on the horn with people and figure out who your cyber tiger team is, who your partnership is within the organization, and you need to establish. This is where the establishment of relationships come. You need to talk to Susie Joe over here, or you need to talk to Bob Joe over there with infrastructure, who's been with the company for 35 years, handling that one server now that's been compromised. From there, you need to be able to figure out how to communicate from a forensics perspective. Are you taking these things and items into digital forensics aspects to do the analysis of the malware? And then from there, you need to understand how we're going to, you know, track this, how we're going to control the narrative. Or is this a reportable offense? And also, how can we make this? There's a term: don't let a bad incident go unused, right? how can we make this benefit us? And we take those lessons learned and we can actually extrapolate them and say, this is how we're going to increase our development of our security roadmap, or whatever the case may be. But at a very, very high level, you need to have something very, very detailed, such as who you're going to call, because Ghostbusters are going to come. The FBI, remember, they're there for their best interest, not your best interest. And how are you going to control this, and how are you going to control the negative or the narrative? I've seen many companies not do their due diligence, not handle the incident response correctly, and what winds up happening is they wind up on the CNN news, and then 6 months later they close out for business. So it's your responsibility and our responsibility to control the narrative and control the incident response and the action itself.
Very well said. I mean, I like your statement, Rico. You got to be your first incident responder, right?
Yeah.
So yeah, and I think I spoke about the pre-market and post-market management of cybersecurity. There are regulations, and some of the things that I personally have seen is better inventory management of devices in the network. I think that Scott also touched base upon. That is, I think, one of the key areas, especially legacy devices, right? I mean, the medical devices are there for longer terms, many years, right? Now, how are you taking care of those? How are you patching those, right? That's one. The SBOM, right? The software bill of materials is gaining traction, and each organization is taking care of it, identifying the vulnerabilities and the control in software systems. And now we have also seen some organizations, obviously the organization focusing on scanning the vulnerabilities on a regular basis with the NV database. But are we doing that, regularly on a rhythmic basis? Quality processes needs to be enhanced. I think that is one of the ways I have seen focus teams to address, which Rico, you talked about multiple roles that needs to exist to address the incident and response, right? Our organizations focus towards building those roles and responsibilities to take care of. And then we have the post market, right, where legacy devices are challenging, security patch upgrades are those taken care of. End of life management has been another area of focus, where the security response needs to be good. And finally, the software security framework that we have in organization, that also is playing a major role when you talk about the current response teams. But yeah, I think this is good discussion. On that note, I would also like to focus on the future state, right? And can we go to the next slide, please? Now, amazing developments are happening in the healthcare and medical technology, and the IoT is playing a significant role, right, in broad range of healthcare applications. And we are talking about managing chronic diseases at one end. We are talking about preventing diseases at the other end. We are talking about clinical care, where hospitalized patients whose physiological status requires close attention, now they can be remotely monitored using IoT-driven non-invasive monitoring. So a lot of things are happening with the pandemic, the COVID-19 pandemic. This has accelerated the adoption of remote patient management, right? I mean, than earlier, this has really accelerated the adoption. Remote care we are talking about. And now the world is also moving towards artificial intelligence. We are talking about those algorithms, part of these devices, many of these solutions. We are also talking about robotic surgeries, right? So the future is amazing in this space. But Scott, maybe you want to take this up. How does the future of IoT security for healthcare industry looks like with these advancements happening?
Oh, well, here's the bottom line, and I want to really throw this out here. The global cost of cybersecurity, and what are we talking about? Stolen money. We're talking about brand and reputation, intellectual property. The global costs keep going up. And there's some estimates that it's between $1 trillion a year and 6 trillion. And everyone's debating on what's the right number. And I say, does anyone really, can you wrap your head around the difference between $1 trillion and 6 trillion? It's still really bad. And they're expecting it to go up by 2023, 2025, it's going to go up 100%. So let's look at the global prediction of the cybercrime problem, and I'm going to throw in IoT devices into that. Okay, the problem's getting worse. However, at the same time, we keep spending money to be safe. So now we have a graph of the cybercrime problem is going up, and we have a graph that goes up in the same direction that says we're continuing to spend more and more money to be safe. Rico, let me ask you, what does it mean if we keep spending money to be safe and the problem gets worse? What does that mean?
It's insanity.
Yeah,
It's
it means we're not
completely
doing it.
insanity.
And then when I tell you that 90% could be prevented, and we're coming up with all these great security standards, but the doctors hate to throw rocks, but I'm not throwing rocks at one doctor. But when everybody wants to use their iPhone for an app so they could sit at home and check on their patients, and they want to check on their medical devices, and they don't, and last time I checked, was the iPhone an approved enterprise device when a majority of the population is not using two-factor authentication? So for me, I hate to say this, I know it's not what anyone's looking to hear, but until we improve the mindsets of the organization, until we improve the hygiene, the information security marketplace is going to continue to make money, and the problem is going to get worse. And all I'm trying to say is if a majority of these things could be prevented, why are we not doing these things first?
Mm-hmm. Yeah. No, I mean, I like Scott. You know, you're projecting the critical challenges, or even the current state where we are not addressing some of the simpler things. But at the same time, you know, these are the devices and solutions that patients would need, right?
Oh,
And then
absolutely.
technology is going to evolve, and you know we have to keep up with the technology. So maybe this is to Rico. Rico, now as a security professional, right now, how does how do we handle this, right? What should be the future of security response should look like? Now, Scott talked about challenges. I want you to address the solutions, right?
Sure.
How would you look at this and to make these solutions work for patients, right? Finally, it's about that. Yeah, go ahead.
Yeah, as the IoT devices become more privatized, individualized, and they go home with us, right? And what's going to happen here is it's going to be the ownership and responsibility for the patients. The hospital is going to only go so far and just provide you the medical application, the medical device, and stuff like that. That's where the buck is going to stop. And that's from their legal perspective, I can see what they're going to do. They're going to say, hey, we provided this. It's your responsibility, patient responsibility. Now, that being said, is we have to treat IoT devices. I always say treat them like vampires. You have to be invited to my home, and I have to know what you're going to do, how you're going to transmit, and more specifically, what you're doing for me. Just because this blood pressure pump sings a beautiful song to you, what is it really doing in the background? Is it capturing your cool, awesome, information, or is it more so capturing all the data in the background as well? So we have to be mindful and actually understand why is this medical device doing what it's doing, and take the personal responsibility to understand, again, the configuration, compatibility, and also where my information is going. So I think that's going to be the future state of IoT. It's going to shift and lift to the patient, and a lot of patients don't know, and that's why we're going to be here for them whenever they need help.
And Amol, one of the reasons that, I take the stance that I do is I just see companies are spending so much money, but they don't focus on these basic things. And, when I've dealt with some pretty large healthcare organizations and big breaches, it didn't really matter. I didn't lose a lot of sleep over it because I would see small medical practices go out of business. I would see their brands and reputation. I'd see these people who work so hard for their whole entire career to try to raise their families get destroyed by cyber criminals. And that's why, to me, it's so important that we focus and we change the hygiene and we change the mindset so we can do this. So, large enterprises have the money, they have the funding for research and development. They can hire chief information security officers, they can buy enterprise level tools. But my soft spot and what drives me from my passion that I hope comes out is I need to get my message out to the non-enterprises in this world, because those are the ones that are the most at risk. So that's what drives me to do what I do.
No, absolutely. I think both these views are really important, Scott, what you're putting, and it helps highlight the risks and challenges and what industries need to do. And at the same time, thank you to Scott, you, and thank you, Rico, talking about how the future might change. Because yes, we are talking about, earlier we have been always talking about patient going to the hospital, patient going to the healthcare. Now healthcare is going towards the patient, right? We're talking about healthcare managed at home, and that also becomes a joint responsibility, or that may become a joint responsibility in future in terms of patients and the clinicians and the healthcare organizations to ensure the safety and security. So a very good thought there. On that note, now maybe we talked about current state, we talked about future state, we talked about the challenges. We have a lot of budding professionals who have also joined. Maybe we can go to the next slide, and maybe let's talk about the message to our audience. So, and the message can, what I would like, Rico, is if you can focus on message for the budding professional, and Scott, I would request you to focus on the experienced professionals, right? What is that message for them? Let's start with Rico. Go ahead, Rico.
So the message to the audience is, I've been harping on this one for many years, is you have to be your own first responder. If not, if you don't know what you're doing, that's fine. Give me a call, I'll help you out, right? The other aspect of it is you have to understand what you're doing and why you're using the application devices that you're doing. At that, understanding the why, starting with why, would always set the preface of how and where and what we're going to do around that. If you need a medical device to provide you medical services, that's fantastic. Let's get you squared away and let's get you secure around using that. And then let's develop a plan just in case something goes sideways. That'll be my message to the audience.
Thanks, Rico. Scott?
My message is, look, the future is not set in stone. We could change the future, but we need to improve our own hygiene. So, how we talk there are pre-indicators of cancer or heart disease. To me, the leading indicator of cyber is, does the end user know that they need to put two-factor authentication on all of their personal platforms? Because if you do not do that, that's the leading indicator. The other thing is, the cybercrime activity that is being perpetrated against children and the elderly all over the world is out of control. So make sure you're educating your kids. I wrote a book about that, but anyone who connects with me on LinkedIn today, I'm going to send you the 2 chapters from my book on keeping your kids safe and keeping your elderly parents safe. Because I am seeing the cyber criminals are sending spear-phished emails that they're targeting the elderly population. And I just had an incident the other day that, Rico, we were talking about this, $350,000 loss because somebody got an email that they thought it was from Amazon, that there was a problem with their payment, and they were requested to provide their bank account and routing information. And as I said, law enforcement is not going to get your money back, and the chances of putting the bad guys in jail are very challenging, but a majority of it could be prevented. So please connect with me on LinkedIn, because to me, that's really what I want you to get out. Keep your family safe. If you know how to do that, you're going to bring that skill and you're going to take care of your organization.
Yeah, thanks. Thanks, Scott, for giving that family touch and, talking about how we also should protect our kids or our elderly parents and all. So that's part. And Rico, I think you talked about being the first responder. I think that always helps. From my side, more of a message from my side to the professional, and it's pretty simple, I would put it. So when it comes to health, right, we always say prevention is better than cure. And my message is same to all the professional, whether they are working in software or security. Prevention is better than cure. So putting right security policies, practices, systems, and tools in place throughout the product development life cycle, when it comes to IoT, throughout the life cycle, pre-market, post-market, is a key. So that would be my message to the audience. And with that said, I think we can move towards our last section of our discussion. Can we go to the last slide? All right. So we had an interesting discussion today, and very engaging one here. We talked about last 55 minutes. We talked about how IoT is revolutionizing the healthcare space, right? We talked about the threat landscape and in the healthcare, which is quite complex. Rico Scott talked about some of those, and I spoke about that. Then we talked about threat actors, their motivations. We talked about the APTs, and we talked about the state-sponsored threat actors and all those things. So, which is very wide landscape. We also talked about how we can do basic hygiene to certain in terms of protecting our password, two-factor authentication. Which can, and it can go to the advanced portion of not the traditional measures may not work, and we have to be adaptive in our approach. We talked about threat actors, motivation. We talked about the current state of security, and we talked about the regulations, what are there, what are getting formulated, right? But I think the message there has been, how do you ensure that those are the guidance, but how do you ensure that those are implemented and practiced in the organization? Then we talked about future of and again the medical, the IoT can bring a lot of change in the medical space, and from the patient's benefits perspective. But from the security standpoint, we looked at that challenge, and we talked about how it could become a joint responsibility between patients and the healthcare providers and the organizations, right? So we discussed on that. We talked about the message for our security professionals. So a very good discussion, and thank you, Scott and Rico. I enjoyed the conversation a lot, and I would like to conclude at least our discussion and then we will follow by the Q&A. That patient-inspired technology is fueling the 21st century healthcare. And for the millions of patients that the healthcare industry is serving, for all these professionals that are attending today, the future starts today for you. We have a promising future of better health, but I think as a panelist and on behalf of three of us, I would like you to invite to sharing these possibilities, to take this secure healthcare further together. So with that note, I would thank you, Scott, Rico, thanks. And maybe I'll pass it on back to Khaled to take over from here.
Thank you so much. Amol, as you rightly said, it was such an interesting discussion with all three of you. And our comment section, especially our Q&A section, has been flooded by not just questions, but appreciation for this session. They all are saying that it's really helpful, it's shocking, it's frightening to hear about the facts and how it can affect you. So we'll move on to Q&A, but before we move on, I have just one thing to inform our audience. So this session is in sync with EC Council certification, which is ECIH, EC Council certified incident handlers, mapped through the incident handler or incident manager role. Anyone with an ECIH certification is eligible for 11,000 plus job vacancies globally with an average salary of $75,000 per annum. If you're interested to learn more about our programs, do take part of the poll, which will be conducted now. So Amol, can we move towards Q&A, because I think there are a lot of questions which are coming.
Absolutely. Yeah.
Okay. So there is first thing. So Benny says, frightening that the patient's personal data can be easily hacked. Yes, we need to be prepared and respond accordingly. How do authorities ensure the implementation of this safeguard? I think, Rico, can you take this up?
Yeah. So one of the things that I would say is, um, again, authorities are only going to do so much. Regulators are going to do so much. You're going to have the proactive measure to ensure that your data is secure. So this is going to be a personal responsibility. What I would say is know your environment, know where it's at. I know which hospitals I go to. I know which doctors I go to. So what I do is actually go over there and understand where my data is at and ask them, you know, it's your patient right. This is patient standard care. You can ask them, where's my medical records? Where's my information at? How are you securing it, and are you doing the due diligence? And at that point, you want to have that conversation, fluidity of the conversation with the medical provider.
Okay. So the next question is, what are the security measures should be in place for IoT devices? The question is mainly inquired for the IoT security products at the time of implementation.
Sure. Is that for me as well?
Go ahead, Rico, take it.
Okay.
I can add.
Yeah, absolutely. So medical devices, what I would say is, let's just say you have a small pump, you have a small something that's going to radiate some sort of or transmit some sort of information. What I would say is look at it at the back of it or the packaging label. It'll tell you how it's transmitting your data, where it's transmitting it, what radio frequency, whether it's Bluetooth, whether it's network, however it's going. I would definitely understand that and take a little more deep dive into it. And then at that point, build a security stack around that. If you're going to develop a product of some sort, bake in SecDevOps into your product development lifecycle.
Yeah. No, and just to add on top of that, Rico, I think following the secure development practices, if you are a software engineer, right, working on these IoT devices, there are various practices right from the requirement stage, incorporating cybersecurity requirement that are relevant to your product, right, in line with the guidance or the standards, and then ensuring that all the for example, Rico talked about communication protocol. How are you ensuring secure communication protocols implemented in your devices? How are you ensuring the authorization, authentication, all those practices, and even the ensuring that before this product is rolled out, ensuring the penetration testing activities that you carry out from the product development standpoint would be helpful. Yeah. Over to you, Khaled.
Yes. So another question is by Anirdham. He says, typically, life cycle of a medical device is 12 to 15 years, and the OS versions are not supported for such a long duration by vendors. The new versions may not be compatible with HW. How do you suggest to handle that?
Yeah, so that's a great question. I've seen this, issue presented quite a bit. Medical devices only have so much capability, and also they only can do so much. And then let's just say they're on a Windows-based server 2016 or whatever, right? And then on the specific device, there's maybe XE or a very light ARM of some sort. The better thing I would suggest is build a security program around that. What are you doing in place of it? Scott brings a great, he harped on the whole multi-factor. If you can implement some sort of multi-factor code, maybe a 3-tiered factor code on top of that, give you a passcode, then a passphrase, something of that matter. If the variable you can't control is what version the iOS is, you need to build around it.
And one of the things too, as we talked earlier, is the segmentation of the network. And we're all sitting here going, hey, we got the firewall's blocking bad. But remember, when we get brought in, it's because information is being exfiltrated out of your network. So we should have that cleared communication path. We do not want a medical device to be able to communicate with an AWS server, right? I mean, that's a problem. What should that device be communicating with? And what kind of software should we be allowing any other things to run in it? It's the same thing that we're seeing now with a lot of the breaches in the utility sectors. Segmentation, looking at the outbound traffic.
Yes. Amol, you want to add in?
Yeah, I mean, Scott and Rico covered it quite well. And again, these legacy devices that have been into system for longer time are challenging. But I think the policies have to be, the policies should be there to ensure that there are security patch upgrades that are happening from time to time. And that, we talked about multiple other measures which require Scott covered. So these post-market management of cybersecurity is very critical for these devices.
Okay, Scott, a question for you. Um, Scott mentioned about having a strategy to deal with the issues in healthcare. Could you share a strategy that a healthcare organization should start with?
Absolutely. Let me tell you what's not a strategy, in my opinion. This might upset some people. When we start dealing with high trust and we start dealing with HIPAA, those are very big regulations within the US. But let me tell you, a majority of my victims were all HIPAA compliant and high trust compliant. Regulations are so important, but remember, compliance is not the same thing as security. Rico, am I speaking out of context?
No, not at all. You are 100% right.
So one of the things that everyone goes like this, hey, I follow NIST. And I'm like, in my career, I have not read NIST. It's 475 pages. I fall asleep after the first 15. The core critical controls are so important for any organization to implement. And there's so many different studies around it that when I say 90% could be prevented by your hygiene, the other 10% is hard. So let's get the record straight. Cyber security is hard. The core critical controls. Do we know what's on our network? Because if we don't know what's on our network, how can we patch it? Do we have visibility on our network to see? I was dealing with a large utility organization yesterday, and they have the ability to detect that somebody put a wireless access point into their network and they were able to shut it down. That's amazing. Can they do that in your organization? Because if not, it's exposed to the internet. So if you don't know what's on your network, how can you patch what's on your network? Also, application whitelisting. Very, very important. Are we allowing authorized software to run on our devices? In IoT, application whitelisting, very important. And do we have a good patch management program? And who's getting who? Patching is really, really hard. However, if you're using application whitelisting, you're limiting your attack surface. And one of the things that we got, and this isn't my line, this is Dr. Cole, who's probably the world-renowned information security guy. Prevention is ideal, detection is a must. If we're using application whitelisting, we reduce our attack surface. That would be the strategy, core critical controls. Rico, what do you think of that strategy? I mean, it's hard to implement, but it's pretty effective.
What I would say is the strategy you actually described is very simple but hard. It's very hard.
Yeah. Cyber is hard.
Okay, sorry, I was speaking on mute. So Scott, another question for you, very basic. Are IoT device forensics like computer forensics?
Oh, that's one that's way above my pay grade over here because I'm not an expert at computer forensics. I managed a bunch of forensics guys. And don't tell anyone, I had no idea what they were doing. So Rico, I'm going to kind of turn that over to you.
Yeah, so the question was the difference between computer forensics and IoT forensics, is that correct?
Yes.
Okay, so let's look at IoT. IoT is a very, very minimal based device or an application, so there's not going to be a lot of data in there. So the best thing you can do is actually live forensics, right? Or you want to jump in there, see what's currently going on, see if there's any nefarious activity, anything calling out or anything like that. That's more going to be live forensics versus computer forensics. You actually have some sort of RAM, you actually have logs in there, and then also you can image the device and pull and extract different artifacts from there. So you can have a lot more fruit in the digital forensics on a computer, right? On the other aspect, IoT is just going to be very light.
Okay. Another question is, Is there anything which can be taken care by an individual to mitigate such threats? Because at the end, an individual's data is getting leaked.
I'll jump into that first. I mean, one of the big problems we're having is we're having a cyber security knowledge gap in the world. We do not have enough qualified people to be able to look at this. And that's where we talked about automation. We talked about artificial intelligence. We talked about having products and services. But remember, every time the information security groups are building products, and they're building that 10-foot fence. The cyber criminals are trying to build that 11-foot ladder. So there is kind of a real big jobs shortage gap in this world. I mean, I think both you gentlemen could agree with me on that. And we need technology.
Yep. No, absolutely. And to add on top of that, that simple things that, what I as an individual can do, right? So one is obviously protecting, if I am handling those devices, protecting those devices from physically from so many threats. That's one. If those have password mechanisms, right? Multi-factor authentication, implementing that, right? Awareness about cybersecurity, which I think Scott brought up a really good point, is very critical. Are you aware of the phishing attacks, right? Are you ensuring that you understand whenever something of that sort happens, what to do? So those are some of those things related to individual. But at the same time, if you're working for this other aspect, working for healthcare organizations, right? We have seen knowingly or unknowingly the data because is getting breached because effective measurements are not taken by the individual, and unknowingly someone takes advantage of that. So ensuring if you're working in healthcare space, protecting the assets of those organizations and ensuring safety and security of those. I would just add, and maybe Rico, if you have anything else to add, please go ahead.
No, not at all. I mean, you guys hit the nail on the head extremely well, and I'm right there with you.
Okay. Khaled, over to you.
Okay, so before we conclude, just a big shout out to Madeline Harris. She's been an alumni and she writes to us, this talk is necessary to hear and not often discussed. So thank you for all the speakers. She really enjoyed the session. And she's also a professional in EC Council. She's an alumni with Cyber Talks. So thank you, Madeline. And before we conclude, anything that guys want to say? Amol, Scott, Rico?
I'll let Scott and Rico speak and I'll conclude.
Please.
Go ahead, Rico.
So if you find yourself in a position with a cyber threat actor or an attack, just remember you have to take matters in your own hands. Be reasonable, be responsible, and be your own first responder.
And thank you. This was just an amazing discussion with obvious two guys who are much more technical than I am. So it was kind of a pleasure and an honor to speak with you. But remember, the future is not set in stone. Work on your hygiene, work on your education, connect with all three of us. Please take me up. Keep your family safe, because at the end of the day, remember, when it comes to your family, law enforcement's not going to save you. So we have to do it and be as Rico said, I love that term, be our own first responder and take the skills, take what you've learned today and share it with your friends and your family. That's my most important thing that I can say today.
No, thanks, Rico. Thanks, Scott. Again, thanks to all the audience. I mean, wonderful questions we have there, and I'm really glad that three of us could connect and interact with the audience. My concluding message again, I'm an optimistic person, and I would say we have a very promising future of better health, right? And this IoT devices or the new technologies, whether it's AI and all, is going to take healthcare to the next level. And it is patient inspired, right? But at the same time, the security challenges are also enough. So those who are attending, please jump into these possibilities to make things more secure, better for our future generations and current generations. So thank you, everyone, and thank you, Khaled and Shilpa for organizing this session. Over to you.
Yes, for our audiences, whoever is asking for their LinkedIn profiles, we will send it to you via a thank you mail, which will be either today or tomorrow. So thank you so much, Amol, Rico, and Scott. It was great having you. It was great talking to you. You are such amazing persons, and your expertise is widely, I think, acknowledged. We have so many comments. We'll send it to you. All of our whoever has sent you thank you mails to messages to you guys. I'll send it to you after the session. And all of our attendees, thank you guys. It was such a pleasure having you. And this concludes the session. You may disconnect the lines. Bye bye.
Thank you,
Thank
everybody.
you. Bye.
Have a good day. See you.
Bye.